urinary system diseases or disorders. Welcome to today's lecture on urinary system diseases and disorders, specifically focusing on urinary tract infections. More than 8 million Americans are affected by urinary system-related health problems. And as healthcare professionals, you may encounter patients with urinary system complaints. The urinary system plays a crucial role in maintaining the body's fluid and electrolyte balance. And along with the respiratory system, it helps regulate blood pH. Therefore, any issues with the urinary system can have significant health consequences. Now let's dive into the causes of urinary tract infections. Urinary tract infections are primarily caused by the presence of infectious microorganisms in the urinary tract, anywhere between the kidneys and the urethral opening. Common pathogens responsible for urinary tract infections are gram-negative bacilli, with Escherichia coli, Klebsiella, and Proteus being frequent culprits. These microorganisms gain access to the kidneys by ascending from the lower urinary tract, starting at the urethra. It's worth noting that bacterial infections of the lower urinary tract are about 10 times more common in females than in males. Improper wiping technique is a common cause of urinary tract infections in females. Several predisposing factors make individuals more susceptible to urinary tract infections. These include 1. Sex. Females of all ages are more susceptible due to their shorter urethra in the presence of pyogenic bacteria in the vaginal vestibule. Urinary tract infections can also occur more frequently in females after sexual intercourse. 2. Urinary stasis. This refers to the stoppage of urine flow, which can be caused by various factors such as stones, strictures, prostatic enlargement, tumors, or developmental abnormalities. Urinary stasis at any level of the urinary tract predisposes individuals to urinary tract infections. 3. Instrumentation. The use of instruments like catheters, diagnostic procedures, and therapeutic interventions like bladder irrigations can introduce infectious agents and lead to urinary tract infections. 4. Neurogenic bladder. This term describes disturbances in bladder function caused by nerve supply impairment. Prolonged urinary stasis and the use of catheters can contribute to neurogenic bladder issues. Signs and symptoms of urinary tract infections. Signs and symptoms of urinary tract infections often revolve around pain. Kidney pain typically presents as a dull ache in the flanks, extending along the rib margin toward the umbilicus. In the ureter, pain radiates from the costovertebral angle down to the scrotum or vulva and may even extend to the inner thighs. During urination, individuals with urinary tract infections often experience bladder pain that radiates to the distal urethra. Laboratory procedures for urinary tract infections. Several laboratory procedures are crucial for diagnosing urinary tract infections. These include 1. Routine analysis. 2. Specific gravity. Assessing the kidney's ability to concentrate urine. 3. pH balance, reflecting the metabolic status. 4. Presence of white blood cells, red blood cells, crystals, and casts. 5. Glucose levels to check for diabetes. 6. Odor evaluation, which can indicate diabetes or other issues. 7. Color and transparency of urine, which can reveal various conditions. Specimens. Culture and sensitivity, also known as clean catch specimens, help identify specific infectious agents. Good cleaning techniques, especially in women, are essential for specimen collection. Additional procedures. Blood urine nitrogen, a blood test to assess kidney function and waste clearance. A cystoscopic examination, a direct method for visualizing the bladder using a tubular, lighted telescopic lens. X-ray procedures, such as the kidney, ureter, bladder, or flat plate of the abdomen, which reveal the position, size, and shape of the kidneys and any renal calculi. Understanding these laboratory procedures is crucial for accurate diagnosis and effective treatment of urinary tract infections.